So today I wanted to talk about something that has been brought to me as a concern from sometimes family members, acquaintances, patients, and the story is always very similar. So the story goes like this. I don't know what the heck is going on, but I am having these moments where I feel super dizzy. I feel like my chest is hurting. I feel like I can't breathe, like I can't get a deep breath in. And sometimes my hands go numb and my feet go numb, and I just don't feel right. And I feel like I might even pass out. And I went to the emergency room. I've been to the emergency room 2 times, and they keep telling me everything is okay. But clearly something is not okay. And so I want to know what's going on. This is a concern that I hear a lot from patients. And the first thing that I do is I assess what has already been done and what has already been checked. And I do a thorough history and physical to make sure that I haven't missed any details. Once I've seen that the common culprits of these certain symptoms have been checked, I then talk to the patient about stresses in their life and possible anxiety. These symptoms are the classic description of an anxiety attack, also known as a panic attack. Now, we don't make this diagnosis lightly, and we really do our due diligence before we give this diagnosis. So the things that I'm looking for in previous records or in the workup in general is, has the heart been checked out? Has the lungs been checked out? Have you been ruled out for what we call a pulmonary embolus, also known as a blood clot in the lungs? Have you been checked for electrolyte deficiencies? Have you been checked for anemia? All of these things play a factor, and there is a big workup that I look for. But once we've ruled all of those things out, we are left with likely a panic attack. Now, please know that a panic attack can happen out of nowhere. These symptoms don't necessarily have to happen at a stressful time or at an anxious time of your life. It can happen out of nowhere, and oftentimes I hear my patients say that they feel like they're going to die because it's so uncomfortable. So know that you're not alone. This is something that can commonly happen. It will happen out of the blue, especially if you have not dealt with a certain stressor or certain trauma that you've had in the past. I see this a lot within about a year or 2 of a close family member passing away. I see this a lot with patients who've had childhood trauma. There are many different things that will affect us mentally, but they manifest in physical symptoms. So that's my healthcare hint for today. I hope it is helpful. And I'm Dr. Kainth with Maple Primary Care. If you like what you hear, follow me at Healthcare Hints with Dr. Kainth.